Hi, good morning. My name is Matt Shanahan, and I am the Biologics Product Manager over with Young Innovations. I'm glad to be here today to give this training for Midwest Dental. What we're going to be talking about are the new regenerative products that we now offer and how those compare and differ from the previous offerings that you've had from our company. My background, I've been a regenerative specialist with several different companies. I was with Zimmer Biomet, now known as ZimV, BioHorizons, OsteoHealth, if you've ever heard of BioOS and BioGuide. I have my certified tissue banking license. And I've been a product manager in Regen for two different companies for Young Innovations, and then I was over with Invista. So I've been doing this for about 15 years. One of our, or your main support person with Young Innovations is going to be Julie Erickson. Julie's got 20 years of sales experience. She's got a terrific track record training sales representatives. She has 6 years supporting Midwest as American Eagle hygiene instrument specialist. And she's really going to be helping with the Puragraph products and also product you'll probably learn more about, the VitaLert emergency kits. What we'll cover in this training is we're going to go over the new distributor allograft SKUs, the cortical cancellous SKUs. We'll also talk about the features of that product, what makes it special, why doctors do prefer the cortical cancellous mix, the new collagen wound healing SKUs, the new membranes, PureExtend and PureFlex, how those compare to the ones you're currently selling, the PureAmend Maintain and the PureAmend Adapt. The PuraFill bone plugs, those and how they compare to the Osteogen plugs you're used to selling and you'll continue to have. And the Puracal sulfate synthetic particulate, and I'll explain how those kind of compare as well. To jump right into the cortical cancellous particulate, what I want to make sure that we're crystal clear on, the SKUs, they're new. Basically they're the same SKUs, but with a -D on the end of it. It is the exact same product as the cortical cancellous SKUs that you've already sold. We just were actually able to lower the price for you. We got a better price from our tissue bank that we work with. So you can basically pass that savings along to your customer. So they're identical. Nothing has changed. It's just at a lower price point essentially for your customers. Now, what we've seen is cortical cancellous bone is the most popular type of allograft that's on the market today. And the reason for that is that the cancellous portion is that scaffolding for bone growth, and then that cortical portion gives you a little space maintaining. So it's considered the best of both worlds, and that's why most doctors prefer this. The really nice part for you is most companies, most tissue banks, upcharge significantly for the cortical cancellous mix as opposed to like mineralized cortical. Our pricing is going to be very similar. So you may have a doctor that would prefer this, but maybe doesn't want to pay the extra money. It's going to be very similar to that mineralized cortical. So again, it's another tool for you to kind of sell into the market. And again, that cortical cancellous, again, it's the best of both worlds with that scaffold with the cancellous, and then that cortical portion, which helps maintain the space. That's volume, right? So they have more bone to place that implant. And we're basically looking at a turnover time of about 3 to 4 months. So the doctor places it, the patient comes back in 3 to 4 months. That bone that they put in is vital. Stick the implant in, and they have a beautiful result with it. The next thing I wanted to discuss is our collagen wound dressing. So I think you're all familiar with Pura Tape, Pura Coat, and Pura Plug, which is by far the most popular. That's the collagen plugs. These are wound healing products. So a lot of times a customer might get these confused with a membrane. All these products do, whether it's PuraPlug, HelaPlug, PuraTape, HelaTape. All they do is they're meant to be put in, create a blood clot, keep the particulate from falling out, and they disappear in about 7 to 10 days. Okay. Now the SKUs have changed for this a bit, and they are slightly different. The plug and the tape are the exact same sizes. There's no difference in the size. There's no difference in the quantity. They all come in a 10-pack like they did previously, and they all resorb in 7 to 10 days. The only difference is that instead of pulling the collagen from the tendon of a cow, they get it from the skin of a cow, dermis. Okay, and the reason that we made this switch, maybe you've experienced this, there's been back orders with the HelaTape and HelaPlug because there's not as much collagen out of the tendon. So by getting it from the dermis, we'll avoid the back orders. So our product is going to be available. You will not run into a back order like you would with the HelaTape or HelaPlug or the HelaCoat. Okay, so you have a more reliable, and again, identical sizes, identical quantities. We actually did a side-by-side comparison, and our doctors could not tell the difference. Okay. Now for the membranes, the Puramend Maintain Collagen membrane that you're currently selling, 6 to 9 month barrier function. It's got a good deal of memory, so it's quite stiff. Memory means a lot of memory means it's stiff. A little memory means it's flexible. That's typically the terms a doctor would use. Can be sutured or tacked without tearing, and a longer resorption profile for ridge ogs and sinus lifts. If you ever get the question, yes, this is cross-linked, just means that there are chemicals added to make it more durable. And again, it comes from the tendon of a cow. And it's 6 to 9 month barrier. Okay. Now we still have this product in stock, but we are going to be moving away from it in about 2 to 3 months. So we still have it, but we also have, and it's currently available for you right now, Pura Extend. Okay. Same barrier function, 6 to 9 months. It is more conformable than the Maintain. So it's stiffer, but once it's wet, it'll lay down a little easier. So it handles better than the Puramend Maintain. Okay. Can be sutured or tacked just like the Maintain, can withstand exposure better than Maintain. That's the big selling portion for you. Doctors, when they put a membrane over the bone, they need to cover the gum tissue over the membrane. Okay. If the membrane's exposed in the oral cavity, 99 out of 100 times, that membrane just disappears. And then the bone is exposed. And then what happens is the bone gets scar tissue and it doesn't fully turn over. This membrane, if the doctor can't close that gum tissue over, it can be exposed. Please mention that to your doctors because that is a huge advantage. So cross-linked can withstand some exposure in the oral cavity, and it handles a little better than Maintain. But the exposure is the big thing here. The Adapt, that's the more flexible membrane that you've been selling. 3 to 4 month resorbable barrier, a little bit of memory, which means it's drapable. So it's not as stiff, right, as the Maintain or the Extend. Used for socket preservation and ridge augmentations, and minimal cross-linking, not as many chemicals used. That's why it lays down easier. 3 to 4 month barrier function, and it can be used for your basic socket extractions, ridge augs, or sinus lifts. Now the PuraFlex membrane, which again, you still have Adapt, but now you have Flex too, and the Adapt will go away. We are gonna sell through it and move to this product after a few months. This has the same barrier function, but the difference is just like the Extend, it handles better. If a doctor wants a membrane that's going to drape, just stick right over. If they put it on their finger, it would stick to it. This will do that better than the Adapt. Okay. And it's the same barrier time, 3 to 4 months. This membrane does need primary closure. So if the doctor can't get that gum tissue closed, they need to do it with this. If they can't, then they would use that Pura Extend membrane we talked about. Okay, so the main thing is with these new membranes, they have the same barrier times as the older ones. They do the same, essentially the same thing. They just handle better and withstand exposure better. That's the best way to explain it to the customer. This is another new product, and this is Purafil. So you're probably very familiar with Osteogen plug, and Osteogen plug is the first bone plug that came to the market. It's very, very popular. And what they did is they took essentially synthetic bone, kind of similar to the Puracal sulfate, and they added it to a collagen plug. So it was really easy to use. So they could take this plug and just put it into the hole, right? And not try to scoop particulate in, and then there's saliva and blood, and particulate can fall out and it gets messy. These are really easy to use, and a doctor that's new to socket grafting or wants to do this fast, they're great for this. This product, Purafil, is made of the same material as Osteogen, synthetic bone with a collagen, basically, plug to hold it together. The difference is this plug, compared to Osteogen, has twice the amount of synthetic bone. The collagen just holds the bone together and it disappears in a few days, right? 7 to 10 days. The bone is what's going to turn into the patient's own bone. So the doctor will see twice the amount of bone with Purafil in comparison to Osteogen. They both work, they're both great, okay? But they're made of the same material, but this one will give you twice the amount of bone, okay? So that's the real advantage to this, to the Purafil, okay? It only comes in a 10-pack, does not come in a 5-pack, and it comes in that 10 by 20 size. That'll be 90% of what you sell. That's the same size at Osteogen, and it comes in the skinny one, that 6 by 25. That's for like anteriors. The Osteogen, again, great product. It's the market leader because they came out first. But you can see 40% bone, 60% collagen. So you get less bone with this plug. But it does come in a 5 and 10 pack, which is great. Some doctors prefer the 5-pack. Okay, just like Purafil, synthetic bone. So there's no donor tracking. The doctor doesn't have to put a donor sticker because there's no donor. It's made in a lab. Okay. So that's the quick run through with this. So we plan on doing more of these trainings for you, and we really appreciate your partnership. We want to be a partner and help you, talking about these products, kind of educating your customers on them, and providing good graft materials for them. So really appreciate it. Thank you very much, and have a great day.